Hello, ladies and gentlemen, and thank you for joining me tonight. It's extremely unusual. I'm usually speaking in front of the live audience, and I love the communication because I'm a hands-on physician, and I love the actual dynamic and the magnitude of dealing with people one-on-one, face-to-face, and get responses. But today we're a bit limited due to the um, circumstances. I'll will try to make the best out of it, and I will be happy with you guys participating and perhaps answering some of my questions. Of course, asking your own questions. We'll try to keep them towards the end. I will try to get to every one of them and answer as much as I can. Today's topic is how to fix your chronic pain without shots or surgery. Um, in some of other webinars, usually my partner, Dr. Natalia, does it on generalizing on stress, hormones, and immunity and the immune systems. I would like to focus today on the topic that I'm uh, very attached to because I've been dedicating over 25 years of my life to learn and to master the ability of helping you and helping my patients, thousands of people that I have seen in the past 22 years of my practice, to deal and to deal with these challenges of battling and hopefully completely getting out of the chronicity of the pain and inflammation. Uh, I'm gonna first ask you a couple of questions. And hold on, let me just get this slide going. Here we go. Start. Here we go. Okay. Uh, does your chronic pain dramatically affect your life? And it's an important question to ask yourself. And does it cause the major limitations in your physical and general life activity? Does it affect your ability to work? Does it affect your career? Does it affect your sexuality? Does it cause any anxiety or depression in your life? Did it cause you to gain weight and not being able to lose that weight? Did it cause any memory changes or chronic fatigue or tiredness or even changes in your blood pressure? And if the answer is yes, then this is exactly what we're going to be talking about right now. Um, Sorry, I'm just trying to manage the slides at the same time. Do you remember when was the last time you actually felt great and had no pain at all? Do you miss that favorite sport or the favorite activity, hobby perhaps, dancing? Do you miss your body being able in general? Well, I'm gonna play a video and I'm gonna explain why I'm playing this video once you watch it. So let me just quickly switch to the video mode.
Hi, my name is Dennis.
My name is Antonina.
And we are professional dancers.
We are two-time U.S. national champions, World Championships finalists, and you might know us from the hit TV show World of Dance on NBC.
As professional dancers, we constantly use our bodies. That's why it's so important for us to stay healthy and recover from injuries very quickly.
Whenever we get injured, we always turn to Dr. Arkady Lipnitsky. He is absolutely the best, he is a true professional, and he is an expert in his field.
Dr. Arkady Lipnitsky always helps us very quickly. He gets us back into the game in no time.
We are so grateful to him and we highly recommend his services.
I guess you did not hear me. I really apologize. I just noticed that my microphone was off. So once again, I would like to introduce myself first, and then I'll explain to you the video and what was the purpose of this video. My name is Dr. Lipnitsky. I'm a chiropractor by training. I'm also a diplomate of rehabilitation and sport medicine, meaning I extended my education and studied in a specialized program for rehabilitation as well as sports medicine. My goal and my profession is not only to find the way to optimize one's movement and optimize one's function, is to eliminate the repetitive injuries that any one of you may have, and most of us do have, and identify the root cause of the problem and eliminate that problem to give your body an ability to live without pain. This particular video, and there's a reason why I played it, played a major role in my life. For many years, my practice was about seeing the patients for acute injuries and eliminating those pain-related symptoms quickly. I got very good at it. My hands-on experience before chiropractic school as a massage therapist, and then developing my own techniques and ways to treat people using my hands, gave me a great opportunity to help thousands and thousands of people getting out of inflammation and pain quickly. At the same time, when I met this couple, I understood that what they were looking from me is a guidance. They were looking for me a way to help them to get out of the chronicity of the problem, because they were already established dancers and they were going very quickly to the peak of the career. Due to the certain injuries and traumas that they sustained throughout the training and performing and the practices, they were limited to be able to do it for years to come without pain. Therefore, was little by little every year they started feeling more and more limitations, and those limitations were affecting their career, were affecting their lives. So treating them for a particular injury was just an immediate importance. But again, what they were asking from me is a guidance. Can we stop this problem from proliferating, from going further? How can we get our lives back together and minimize our traumas? Can we change something in the way we physically doing? And that pushed me to really go into significantly more education and research and traveling around the world, as a matter of fact, trying to learn different strategies, different techniques, the way they function versus the functional treatment versus the physical treatment. And when we're talking functional versus physical treatment is what I have been doing for years, but functional treatment is something that I can look at your function, and perhaps by modifying the way you move, modifying the way you physically act in daily life, was a basic activity, can alter the vicious circle of the inflammatory changes and repetitive injury. So I would say from this couple and a couple of their colleagues, my career started taking a completely different path. So throughout this unique educational experience, I understood that there's a difference between functional and physical treatment. Most chronic conditions are preventable by functional approach because they are repetitive in nature. Again, most of our physical conditions, physical pains, whether it's a disc herniation or meniscal tear or what have you, most of these conditions are not due to the acute injury. Most of them are repetitive in nature. It's a repetitive injury process that takes, accumulates and creates this major inflammatory and pathogenic changes. So why chase the pain without addressing the source of pain? So my goal is to help the patients to sorry. My goal is to help the patients to learn as much as they can about themselves and understand what creates this pathogenic pattern. Also give them the tools, so it's educational just as much as the treatment, because my goal is for the patient to leave with a very significant tools and confidence and knowledge to continue changing their lives. Today we're going to talk about different issues. Today we're going to talk about the inflammation. We're going to talk about the repetitive injuries. We're going to talk about what causes the inflammatory changes within the body. I'm going to try to dispel the myth and even kind of make you a promise. I can promise that what I'm going to give you today, the information, the value of information you're going to hear today is probably more than you got from any other physician that came before me. That's a pretty big promise, but I know I can deliver this promise because, again, my goal is to change your health and hopefully change your life with it. Listen, once upon a time, I was also one of the physicians that believed that treatment should be symptomatic. You have a symptom, you get a medication, or you get a quick fix treatment, and you feel better. But through my personal health battles, as well as the patients that were asking for much more, a bigger picture, really a recovery treatment versus the quick fix, I had to come to completely different conclusions, and I would like to share those conclusions with you today. I hope you can see this. Yes, okay. I don't want to bore you with the statistics. I just want to go over a few things because I think it's important to understand the degree of a problem that we have today. So about 1 out of 4 Americans, that's 54 million Americans every year, develop arthritis or have arthritis. More than half of the adults with arthritis, it's 32 million, are younger than our geriatric patients. They under the age of 64. Most of these people have other underlying conditions. Arthritis doesn't come by itself, and that again, it depicts the point that any chronic degenerative changes, they don't just come along. Most of these people, as you can see, also have heart disease and diabetes and obesity. So another statistics I would like to share with you is the pain level, the chronicity of pain. If you can see right now, it's sorry, my slides are misbehaving today. So the chronic pain is by far so much more than any other disease, the chronic disease that we see. It's bigger than cancer, heart disease, diabetes. It doesn't matter whether you suffer from frozen shoulder, chronic pain, or chronic back pain, knee pain, hip pain, arthritic changes. Most of these conditions have a common underlying problem. And this is one of the points that being significant, it's been missed. So 90%, and I think it comes straight from the World Health Organization, 90% of all chronic degenerative diseases that's prevalent today cannot be treated by orthodox medical procedures. Think about it. The World Health Organization states that 90% of all chronic diseases cannot be treated by today's orthodox medicine. So what does it mean for your health? Pretty much means that most likely whatever you're doing today to solve your health issues isn't working, and it's just keeping you in the same condition, if not making you worse. How many of you are taking a prescription medication for your pain, whether arthritic pain or any other musculoskeletal condition? Have you figured out yet that it's just not solving your problem? Do you think by taking this medication you can stop the problem or be cured? It's really important that you understand that our healthcare system in this country isn't whole. It's absolutely broken. All the numbers are just getting worse every single year. The heart disease getting worse, cancer getting worse, diabetes, obesity. Even in our children, this chronic degenerative disease, the numbers are rising every single year. So I apologize again. This is getting a little crazy. It's not working for me. Boy. Okay, we're back here. So the question is, what do we do in order to seek the resolution for these conditions? We need to understand that some of the things that we're doing right now are not only helpful, they are destructive to us. Our medical system is great, and we can see right now the way our hospitals and medical system managing, hopefully now it's actually better, but managing the COVID-19 patients, the way they're managing emergencies in general. It's a great system, but the problem in the system that the system is not designed to address the chronic degenerative conditions. Our medical system is great to deal with emergencies, but most of the people are suffering or dying from a chronic degenerative conditions that's slowly stealing our life away. Let's first try to understand why the ship that we are on is not only burning and sinking, but taking us with it. And what is wrong with the traditional system? Why is it not working? And for that, I would like to show this slide that really, I believe, depicts really well how our system is set up. You go to a physician, and each physician is responsible for their own body part. And each physician is literally just dealing with the symptom of that particular body part. So fundamental problem with the current system is not addressing the underlying cause of the problem. And please be aware what you consider to be healthcare. More and more doctors, not just me, but more and more doctors are looking at healthcare, and this is a great expression that I stole from Dr. Whale, who is one of the founders of integrative medicine in the United States. He said that we don't have the healthcare system. In this country, we have a disease managing system. Think about it. Healthcare system versus disease managing system. It's pretty scary. And a lot of us think, and by the way, that's a great question I would like to ask you guys. Why do you think we have this system? Do you think the problem was perhaps health insurances? Do you think they should be given to everybody, and maybe that would be the solution to all these issues? And as a matter of fact, this is something interesting that I picked up at some point from the Medicare. It's very interesting to start reading those manuals, even though I'm not a part of most of the insurances for a very particular reason, which I'm going to read right now. But when you look at this, let's see what the healthcare system, what the insurance system that pretty much controls the healthcare system today, let's see what they say. This is, by the way, it's literally straight from the Medicare. Services that seek to prevent disease, promote health, and prolong and enhance the quality of life, or maintain or prevent deterioration of the chronic conditions are not medically reasonable or necessary, and it's not payable under the Medicare program. Just think about it. If your condition is chronic and it requires a 180 degrees turnaround and an approach that will have a long effect on your quality of life. So anything that stops the disease, prevents the disease, promotes health, and prolongs your life apparently is not medically reasonable or necessary. So what they're trying to say is, if you want to deal with if you want to be healthy, you want to deal with a chronic condition, this is up to you. And they only want to be responsible for acute care. And that's what it basically became today. You have an insurance to deal with your acute injuries and acute distresses via medication that will control those symptoms. None of the medications actually created to change any of your conditions for long term. None of the medication, just if you think about it, none of the medication we have on the market today actually treat anything. They just reduce the symptoms or stopping certain conditions for the time being while you're taking the medication. For example, the high blood pressure, right, or blood sugar level, or your thyroid. So the medications are there just to control your symptoms, but you stop taking them tomorrow, what happens? It goes back. So that's when I would like to give you another story, because this particular person also gave me a completely different ideas and direction to my career as well. Dr. Natalia, we met. She was a patient of mine. I hope she doesn't mind me sharing, but she was battling her own chronic condition with back pain. And she came to me because she heard that what I do is really mechanically restore your ability to move and stop this chronic deteriorating process of repetitive injury. What I learned, she was probably one of the fastest recovering patients who had probably years and just needed the right approach to the back pain. But what I learned from her, and she's a functional medicine specialist, that the stuff that she was doing and she was offering to her patients and she did for herself dramatically changed not only how fast she recovered, but also how she was able to stay out of this problem for years already. So what I learned from her is that we have something else happening within the body that can easily trigger all our inflammatory conditions. So it's not just where it hurts. It's not just your mechanics. It's not just your ability to stop repetitive injury process. It also the inner you, because what's happening inside of you controls exactly what's happening in your joints, in your muscles, and your physical abilities. So by me again changing my direction one time in my career and really trying to understand and learn what is that she knows and what other functional specialists, functional doctors are doing, and what they do is very remarkable. They actually, instead of looking at body parts and body organs and pain areas, they look at your body. And they trying to understand based on the right testing, looking at your genetics, looking at your blood, looking at your urine sample and stool sample. They're trying to analyze you. What is wrong within your body? Is there something underlying inside of you that causes this repetitive inflammatory conditions and repetitive changes? As a matter of fact, I learned something very interesting, that most of these inflammatory conditions, they start deep inside, and rarely they just come from the traumas or micro traumas or repetitive traumas of the joint, muscles, tendons, or any other musculoskeletal areas. So I just put it this code because that's a very important point, that doctors should be always in search. There's never a magic pill. There's never a magic wand. It's always a developmental process that just makes you better every year if you keep on studying and keep on changing your approaches to care. I would like to go over the basis, and again, I'm not going to try to bore you with this, but I think we should understand what arthritis is and how we develop it. So this way we can understand what works and what doesn't work for it. So after a certain age, we begin developing arthritic changes. You can see on one knee, it's a perfect cartilage. On the other knee, we see this big potholes and erosions that's happening within the cartilage. And it usually happens because our joints and the spine are breaking down slowly, steadily, and at a rate, unfortunately, faster than our body can fix itself. So again, that's another point, that our body starts being depleted, starts being limited of the most essential components that actually rebuild us, right, or regenerate us. An attempt to manage these arthritic symptoms, your pain management or healthcare provider usually suggests what? Anti-inflammatory medications, or even worse, corticosteroid injections. So please think twice and hopefully research some alternatives options. But I just want to share with you my view on this. And for that, I would like to bring the slides so you can see just some of the side effects that I have listed. Let's start with non-steroidal anti-inflammatory medications: Motrin, Advil, Aleve. Most of those medications, again, they only reduce the inflammation for the time being. There's no long-term treatment solution in them. But what do? They raise the risk of the heart attack, stroke, ulcers, stomach bleeding, sudden kidney failure, or kidney damage. Not very pleasant, okay? Even worse, they offer you a steroid injection. Again, I would like to kind of explain that I'm not against a steroid ever. There's certain times in our lives that it's absolutely essential. Again, absolutely essential for us to get the steroid treatment, because our life, our health, our future depends on this. But to introduce this as a method of treatment for every single inflammatory condition that you walk in with, this is not right. So steroid medication, whether injection or through the pill form, it causes cartilage damage, death of nearby bone, that's if it's injected into the joint. About joint infection, nerve damage, temporarily facial flushes, that's already hormonal imbalances because it's a hormone, right? Temporary the pain and inflammation flare, the blood pressure, blood sugar level goes up. The how about tendon and soft tissue rupture? Matter of fact, it's very interesting, and again, nobody talks about it, but if the corticosteroid gets injected into the soft tissue has a certain protein that holds like a glue, holds your muscles, the tendons, the ligaments, the fibers, holds together. The corticosteroid actually eats away this glue, so it disturbs that binding mechanics of your soft tissue, and now there's no more a single strong element. Now we have fibers, and those fibers easily tear with the physical activity. So it actually predisposes that muscle, tendon, ligament that being injected with corticosteroid to a future tear. And we often see it in athletes, not only in athletes, a lot of older people that going through these injections, I see them almost daily with a muscle rupture. So how many of you, one more time, I'm going to ask this question, because how many of you are taking some sort of the prescription medication for arthritis or any other musculoskeletal conditions? So again, think twice. In my opinion, the increase in numbers of hip and knee replacement is the direct result of the injection of corticosteroids into those joints. It's absolutely the fact, and you can research that. You can see how many more people are getting their hips and knees replaced, and how much more injections are being introduced for treatment of these conditions of inflammation of the major joints in the past 20, 25 years. So let's try to understand why we get into this, what causes us to be in this chronic mechanical distress. So for many years, we tried to become from the ape, become humans and walk upright and move. And now we're pretty much back in ape's world because we sit all day. And I would say that most of us who sit all day feel probably this way. Uh, it's not a great feeling because our bodies are not designed for this. Our bodies are designed to move. Our bodies are designed to be active. Our bodies are designed to be flexible. We adapting and we unfortunately compensating to this condition. So when we get up after this prolonged sitting, we probably look something like this. And again, this is just to point out that our physical daily activity directly relate to our chronicity and how much changes we go through and get adapted to by the change in lifestyle, like sitting. Uh, have you ever seen the guy walking the streets looking at his phone, just like this handsome fellow? Well, again, this is just to depict the point that normally our head weighs about 10 pounds when we are looking down just a bit forward, and that it actually comes with just a poor posture. Now we have a load of 20 pounds on our discs of the spine. And when we look at the phone like this, now the load is almost 30 pounds. So just to give you an idea how much damage that can cause, that's why we have an enormous amount of disc herniations that we see right now. Before we would see more in lower back, now we see significantly more in the neck. And I would say this is probably the leading cause of that. So again, think twice, think what you can alter in your lifestyle. And we get many degenerations of the joint. Just the slide just shows what the facet degeneration is, and it's this diagnosis that we see practically on every MRI now. Even young people have degenerative disc disease, which is those wrinkled discs on the bottom of the slide on the left side, and the arthritic changes of the joints of the spine as well. I want to share you another story with you, and this is my mom and my dad, and this is my girls, my two daughters, and just want to give you a quick story about my father. Unfortunately, I lost my father about a year ago. He had a brain cancer, and he left us very quickly at the age of 83. But when he was a young fellow, young guy, I believe me and my brother, a twin brother, me and my brother were only about 4 years old. My father suffered a heart attack. He was only 37 years old. And it was a pretty massive heart attack. And as a matter of fact, followed by a really bad back injury as well. He was lifting something, and so with these two conditions, he was in the hospital for a while, and he was released with very specific instructions. And the reason why I keep on remembering that, ever since I can remember, I was 4 or 5 years old, my father would get up in the morning every single morning. Doesn't matter whether he was sick or healthy. Doesn't matter what time he had to get up to work. Doesn't matter whether he was traveling for work. He would get up, give himself an extra 40 minutes, and he would do his exercise routine every single morning. As a matter of fact, it was a breathing routine to work on his heart muscle, and it was a back exercise routine that he was giving back in the rehabilitation center. And it's remarkable, but my dad, he had other medical issues, but his heart was absolutely perfect. Whatever routine he stuck to and was doing ever since he was a young guy, and to have a heart attack at the age of 37, it's bad enough. It scares you for life. But for years to come, when I grew up in Ukraine. I was 16 when I came here. My father was already 53, I believe, 52, and ever since we came here, and he was checked out by a cardiologist pretty much yearly. he couldn't find, the cardiologist could not find any evidence of the massive heart attack that he once had. That's how well our bodies are designed to heal themselves when we give them the right environment. Again, it's just something to point out that you can help yourself so much more than any other physician. You just need the right direction and you need to stick with it. So just something I wanted to share with you. And I love this expression because it's insanity. It really is. Is doing the same thing over and over again, expecting a different result. So my question to you, what do you think you're going to change in your life? And I guess it's fair to ask me, doctor, you just gave us all this bad news. What's next, right? So what now, give us a solution. What can we do to help ourselves, right? So it's just fair to me for me to go over what I found to be, and it was treating thousands and thousands of people. It was a really great success of recovery, long-term recovery, what I found to be missing pieces. So I'm going to go one by one because I believe each one of them has a great importance. Can we expect a body to be healthy or perform any healing, internal healing or regenerative healing without a proper nutrition? The answer is no. If we don't have the right nutrients feeding our body, there's absolutely no way we can be healthy because our body is dependent on a very particular nutritional components. No other things can substitute what we eat and what we drink, and the quality of those products are absolutely crucial for our health. But can we bring this great products into our body if our body already cluttered with toxins? And look, it doesn't matter how old you are, it doesn't matter where do you live, it doesn't matter what lifestyle. Well, lifestyle matters a bit, but we all have toxins within. We all have accumulation of stresses and accumulation of toxic elements in our brain, in our liver, in our stomach, in our gut. And we don't bring in new furniture into the new house or into the house in general without uncluttering, right? Without getting all the garbage out, without cleaning it out and make it nice and clean, and then you can bring in new furniture in. So detox play the most crucial role in any nutritional restoration process. Hormones. Hormones run our lives. It's absolutely crucial for us, whether it's hormone to deal with our sugar level, whether it's our thyroid hormones, without pancreas or any other hormonal the glandular activity that we have that designed to release the hormones, and they make us. So it's absolutely crucial to have them balanced. Otherwise, everything is whacked. Nothing's working. Fitness and exercise. Can somebody be healthy without proper physical activity? And really finding what is the proper physical activity for them. Everybody is different. The physical activity should be different as well. So can we live without fitness and physical activity? Absolutely not. None of our organs can function, including especially our musculoskeletal system, right? Proper regenerative treatment. When I say regenerative treatment, I think there's a lot of misconception and misunderstanding what regenerative treatment is. And when you say regenerative treatment, right away we think, oh, stem cells. Well, we do stem cells as well, but very, very few people really need stem cells. There are many other approaches to help the body to regenerate, whether it's a prolotherapy that regenerates ligaments, whether it's shockwave therapy that restores the soft tissue, muscles, tendons, whether it's PRP, which is platelets, that help us to restore our cellular activity, and it doesn't matter which one. It's a musculoskeletal, or it's hair, or it's within the blood. So it is crucial. It is very important, and it's important to introduce it at the right time with the right treatment. And mentorship as well. So I would like to touch upon each one of them, because I believe each one of them is by itself very unique and important. And considering that right now we are still dealing with the COVID-19, and a lot of people are worried about the immune system in general, I would like to kind of clear something. Immune system is an operation system of our body. That's what operates our body. If your operation system is dysfunctional, everything else falls apart. And your body gets into what we call a distress or dis-ease, right? The word disease comes from the point of the body at dis-ease, or in medical term, disease. So let's get science right. The immune system doesn't get attacked by the virus. The immune system is there to fight the virus. But when the immune system is weak, it's unable to do so. So, and the same thing goes for regenerating your body. The same thing goes for dealing with other bacteria and other viruses within the body. And it's extremely important to spend time and finding the ways to boost the immune system. Again, something we're definitely concentrating on. Detoxification. We all live with different stresses. You know, the toxins all around us, the air, the food, the cigarettes, the alcohol, cell phones, big time, the computers, the wireless technology, vaccines, talking about the toxins altogether. They all contain toxins, and they all suppress our immune system. Toxicity, radiation from cell phones, wireless technology, they all affect our brain as well. Genetically modified food, or fast food, you know, for that sake, you know, makes us sicker and sicker. But so it significantly lowers the immune system. So you spray here. There's three different, you know, main components of toxicity: physical, chemical, and emotional. So not putting your body through detoxification is really limits you to make any long-term changes for your body in general. When we talk about nutrition and gut health, and I would like to spend a few minutes on that, because I believe it's very crucial and important to understand what exactly the gut health is, and why, and what happens within the body. So most of you probably heard about leaky gut, and how it affects our digestive system. I can say that nearly 100% of my patients have leaky gut syndrome. I know I had it. I know most of my family members had it, and in modern life, that's unfortunately it's a given fact. The so the what we eat and how we eat it plays a crucial role in leaky gut. So the American diet in general is very low in fiber and high, unfortunately, in sugars and saturated fats, as well as, in addition to that, environmental toxicity, medication play a huge role, infections, and even stress. So all these things may initiate this process of leaky gut. Alcohol consumption, of course, does it as well. So now we know that leaky gut plays a very crucial role in the certain gastrointestinal problems like celiac disease, Crohn's disease, irritable bowel syndrome. But many studies right now showing that it also plays a most crucial role in the health of autoimmune system. So it actually is closely associated with autoimmune diseases like lupus, psoriasis, multiple sclerosis, as well as the chronic fatigue syndrome, fibromyalgia, chronic joint inflammation, pain, even arthritis, allergies, asthma, acne, obesity. The list is on and on and on, even Alzheimer's. So let's try to understand what leaky gut is. As you can see on the diagram, we have these little passages from the lining of our stomach and the small intestine. We have a little passages. So imagine you have a little drawbridge, okay, and you have a little stream where small boats can go under the bridge, and they bring in nutrients into our bloodstream through the lining of our intestine and the stomach. Now, all these chemicals that I explained above, they raising up the drawbridge. So basically, the drawbridge comes up and never closes. And what happens? We're pretty much getting all the toxins that supposed to go through the gut and being dumped out of our bodies start seeping through these large cracks into our bloodstream, and basically they poisoning our blood. So to understand my slides keep on jumping. Apologize. So when this happened, our immune system, when this toxins getting into our bloodstream, our immune system responds by mobilizing army of white blood cells, and they go inside. They start fighting. They start creating something called fibrin. It's like a seal. It's like tons of protein that tries to create like a mesh, like a seal for those cracks. But at the same time, it scars up the lining of the intestine and the gut. So under normal circumstances, your body releases something called proteolytic enzymes that dissolves this fibrin, and it restores the proper function of the stomach and the gut. But when we keep on eating the wrong food and bringing more and more toxins, unfortunately, it just not the action is not there. We don't have enough proteolytic enzymes to dissolve this protein, to dissolve this mesh of fiber, and it creates the chronic passage of this toxins into the bloodstream. So by creating it, we basically bring our immune system to crisis. Addressing the leaky gut, I believe is one of the most crucial parts of any treatment of chronic inflammation, and not only that it can be diagnosed, truth is it can be really easily addressed. And it's interesting that in 1982, one of the Columbia University professors, Dr. Wolf, discovered that by introducing a proper proteolytic enzymes to our diet as a supplement can actually help significantly to dissolve the scarring and practically stopping the process of leaky gut in our bodies. Of course, the diet should be accompanied, and changes in our diet and lifestyle should be accompanied. But what was the last time you heard it from your either gastroenterologist or primary care doctor that helping you to deal with your digestive system, not even touching the chronic inflammations of autoimmune problems, but even dealing with the digestive system, bloatings, maybe the gases or acid response, right? So any of those symptoms, the chronic conditions that have to do with your bowel movement, right? All of these conditions can be easily controlled, but guess what? It's not a medication. It's simple lifestyle changes, and it's a simple additives to your supplementation to your diet that can really make a huge difference in your life. But unfortunately, since it's not a medication, you do not hear that from your physician. When we talk about the exercise, and again, I think it's important to understand that exercise is extremely important, but the exercise should give you much more than it takes. In the past 15 years, the number of people attending gyms, attending centers, went up from 30 million to 60 million. Think about it, it's doubled. Okay, so to fight and prevent the weakening, as well as being, the problems with joints, people are trying to get healthy. In the same 15 years, incidence of serious low back injuries and disabilities went up by 40%. 40%. Patients diagnosed with one of the forms of arthritis went up 20%. Almost many adults, actually, the obesity, right? Obesity went up 20%. What do we do wrong? What is missing? And I think what we're missing is a really proper guidance of what physical exercise should do to each individual person, and what form of exercise we should pick and choose for ourselves, and not just to follow the new trendy routines that we often see from great trainers on YouTube. So here's what we're missing. Missing pieces have to come together, and I believe this is the key to success. Some of us tried diet. Some of us tried exercising. Some of us tried perhaps changing lifestyle. Some of us tried regenerative treatment and addressing hormones. What was missing is that 94% of all failures is due to not having a system. We cannot pick and choose which one of those points is important. They all are crucial. They're all important. They're all essential. So by not putting them in the one system, and if you notice that one of those triangles is a mentorship, and that's something that we're definitely missing in today's medicine. Unfortunately, the word doctor comes from the Latin root and says it means a teacher. The doctor means a teacher. When was the last time your doctor had time, patience, and knowledge to teach you something that you can do for yourself and take the charge into your own hands and take charge of your health and make a difference in your life, right? Unfortunately, as we learned prior in the Medicare rules and regulations, they're not there to pay for that. They're there to pay for surgeries, injections, and medication. Therefore, the doctors are mandated not to spend time on that. It's not that the doctors are bad and like they cannot teach you something good. They simply don't have time. They're not given time because they have to obey the rules and regulation of the insurance company they're serving. So unfortunately, many of us are not serving patients. Unfortunately, many of us are serving the insurance companies. So putting this, all these pieces together, that's what makes a successful treatment. And I want to emphasize on mentorship because I believe that this phrase definitely said a lot. That tell me and I may remember, show me and I will remember, involve me and I will understand. Not involving our patients into their in a project of their healthcare, not giving them tools to learn about themselves, not giving them tools to be able to control years and years of their health to come. That's the biggest weak point. And if you want to fly a plane, if you want to learn how to fly a plane, do you think it's enough for somebody to give you a prescription, right? Somebody give you like, well, here's the manual, just read the manual, fly the plane. I'm not sure if I would be a passenger in your plane. Quite honestly, I think it takes hours of studying the material and then a good mentor to sit next to you and take you step by step through the process of learning to fly the plane, of lifting up, landing, of cruising, and everything else that comes with it. I think same thing comes in a wellness approach to health. And that's something that I can proudly say that we're able to put together is a not only comprehensive program that will address all this parts of your chronic health condition, but also give you a proper mentorship to take you by your hand and walk you through this process and make sure and keep you accountable, make sure you actually finish it and stick with it and really get to your final destination. Listen, the truth is, it's our choice how to live this life, and each individual choice. And the question is, what is your choice? Both of these ladies are 80 years of age. What is your choice? Who do you want to be? I see we're finishing up, but generally the way we approach our program, our consultations, we need to identify that we can help you, number one. Number two, that we're a match, because what we're offering a kind of a longer term solution that really will take you out of your chronicity and into your health, but it's a partnership. We need to understand that you're ready to go along and do what we tell you to do and be a part of this. Realistically, we cannot do it without you. It's not just simple by giving you a prescription and have you taking medication, as you understood already. Considering that now we're still kind of in quarantine, and I actually found that it's very useful this time to learn how we can modify our daily activity. So what we would like to offer right now is something very different. We would like to offer you a free discovery call. It's that simple. We're not going to drag you into the office to do our analysis and assessments. And we would like to talk to you. Really go through your particular situation, understand what your complaint, what your problems are, and understand whether it's something that we can help you with and give you an idea of what we can do for you. And then let you make a decision whether it's something you would like to approach and start dealing with. And at that point, yes, we'll have a more formal consultation when we actually have, do a proper physical assessments and run the right tests, because, treating somebody without understanding what the underlying cause is walking around blind. So I would like to offer you, actually, we're going to extend this offer right now. The seats are limited. We cannot get on the phone with everybody. So we have about 15 clients right now that we would like to offer a free discovery call, either with me or with Dr. Natalia, or two of us, and really to understand what is that bothers you that we can potentially help you with, and really get into your particular problem. You're welcome to register. I believe there's a phone number, as well as the registration should be visible right now on your screens, and that should be able to give you an opportunity to do the discovery call if you found what I just told you to be useful, and if it made sense. Everything has to make sense. If you have any questions, please ask me. I would love to go into, I guess, some of the answers, some of the details. I apologize again. I'm not used to just do all this presentations online, so I had a little hiccups, and my apologies for hiccups. Any questions? Okay, now I found the chat box. Great. Okay, you guys were complaining there was no sound. I fixed that, I believe, right away. Okay, unfortunately, okay, I guess no questions. Maybe I covered everything. If that's the case, I'm looking forward to have you guys on a discovery call so we can discuss your individual problems and see if we can help you with it. And I was happy to be a part of the evening, and hopefully was able to give you some valuable information that you can carry in the future. Thank you and have a good night.